Hi, my name is Dr. Sanchia Gunawardena. I have 846 publications and 13 books. So if you're a patient watching this and you've just been told you may have a diagnosis of prostate cancer, then this is the video for you. So essentially what happens is when you are tested for prostate cancer, your GP checks your PSA, your prostate-specific antigen. This is an enzyme produced from the prostate gland, and it's raised in a number of things, including in prostate cancer. Simply causing trauma to the prostate gland as well can increase your PSA level. But it's very important because for us, it's like a red flag marker as to whether a patient has prostate cancer or not. Your GP will then refer you to a urology doctor who will assess you with a digital rectal examination and check your PSA again. Now, what's really important is as part of their investigations, they'll do an MRI and they'll do a biopsy of the prostate. For the biopsy of the prostate to be conducted, a probe will be passed up into the back passage. Through the skin beneath the prostate, biopsies of the prostate gland will be taken, and then those will be sent off for testing. Now, after the testing, what you may find after the biopsy is that you feel quite sore down below. You've got things like going often, going quickly, a little bit of burning pain. That goes after a few hours. You can also have things like blood in the water, blood in the sperm, blood from the back passage, which should settle down over time as well. Or you may have problems like not being able to go to the toilet properly, which may require a catheter. This is just a long thin plastic tube that goes into the bladder to drain out the urine, which is removed in a few days' time. You may also have problems like erectile dysfunction. Now, what you've got to do after that is you've got to have a CT scan of your chest, your abdomen and your pelvis. And this is really important because it tells us if that cancer has gone anywhere else. And prostate cancer is categorized into low, middle and high risk groups. So it's really important for us to see which group you are as to what type of treatment you can have. And this is why we do these staging processes to give you a grade and to give you a stage. Now, the grade of prostate cancer depends on what the cells look like under a microscope. If they're very nice and aligned, then it's a low-grade prostate cancer. If they're a bit more mixed up and variable, then it's a middle-risk prostate cancer. If they look completely abnormal, then it's a high-risk prostate cancer. And that's also really important for you to remember when you think about your staging and your grading. I'm going to do another video on the treatments of prostate cancer, so I'm hoping you'll watch that. And I hope this has been a help to you in your journey. And remember, stay strong and stay as fit as possible, because that often helps us decide what treatments we can give you. And if you are very fit, then you will be offered things like surgery. So that's also really important to remember in your patient journey. Thank you and goodbye.